I'm Dr. Paul Shaw. It's very nice to meet you. I'm one of the consultant team at Velindre Cancer Centre. I'm likely to meet you if you have a lung cancer or upper GI cancer. And I'm experienced in treating these cancers. I've worked at Velindre for many years now, so have met lots of patients in a situation you perhaps find yourself. And just be reassured that you're going to be looked after by a great team that are used to looking after people in similar situations. And it's not just us as doctors working alone. We have a great team that works with us, including nurses, physiotherapists and dietitians, occupational therapists, to help focus on the best care for you. So you might meet me in the first consultation as a new patient, but you'll then meet other members of the team, and that might include a specialist nurse, for example. So if you have a lung cancer, we may treat you with chemotherapy, and that might be intravenous chemotherapy requiring visits to Velindre, or potentially a tablet form of treatment if you have a particular target that we can treat with an oral tablet. I also use radiotherapy, and that might be given over a prolonged course of time to try and get rid of your cancer, or it could be a shorter course of treatment to try and control the cancer. Either way, we do our best to try and give you the best treatment that will give you the best outcome. But we'll also focus on what's important for you and your quality of life. And it's very important that when we first meet that you make it very clear what are your priorities, because at the end of the day, we're here for you to ensure that we provide the best care that's shared and that we make decisions with you. If you have an upper GI cancer, then we also use chemotherapy to treat that, but also radiotherapy or possibly a combination of both treatments. And again, we have specialised teams to look after you, and you'll probably meet one of our dietetic colleagues who have expertise looking after the nutritional aspects of patients with cancer, which is often a big concern for people who can't eat the normal food that you're used to eating. It's not always possible to cure cancers, but you can be reassured that we can still often provide treatment to help you with the cancer. And we also work very closely with colleagues in the community called palliative care colleagues, where the focus is to make sure that we're maintaining your quality of life for as long as possible and to help you live with the illness you have. We may talk to you about clinical trials and research, and that's something that we're very active with to ensure we're giving you the best treatments and treatments that you may not be able to access through standard NHS care. So don't be surprised if we do talk to you about clinical trials, and those trials may include early phase drug radiotherapy trials, which we're actively supporting in Velindre. So I do look forward to meeting you if I have that privilege and for helping put your mind at rest at what can be a difficult time.